Hi, this is Dr. Doreste with the Cranial Release Technique. And I wanted to speak briefly to practitioners in general, but to non-practitioners as well. There's always been a question that I love to ask a new patient when I sit down and finish with the consultation. Why'd you come to see me? What's troubling you? Maybe do some brief evaluation. And then I finish up before I get into the explanation of CRT with the question, what is it that you like to do for fun? And that's a very interesting question for me because this is now opening a window into the patient, because they may say something like, well, I like to golf, and gee, with this back trouble I'm having, I can't golf like I used to. Gee, I like to go hike in the woods, but with this knee issue, I can't hike like I used to. Or you might hear something like, I really don't have fun anymore, which is another indication of what's happening, again, when the nervous system is blanketed by stress. So remember, stress, be it physical stress, chemical stress, emotional stress, or EMF, electromagnetic frequency stress, all this sort of covers over the brain's ability to function optimally. One of the things that the brain likes to do is have fun. As I said in previous videos, just watch a child. With them, it's fun, fun, fun all the time. Now, again, I know they don't pay taxes, they don't have to go to work every day, they don't deal with the stresses that most adults do, but yet they're more in tune with just the natural world, fun, explore, taste, try a new toy, interact with new people, whereas most adults, again, and I think blanketed with this layer of stress, aren't as open, as free as the children are. But back to the question of having fun. So when I ask a patient, what do you like to do for fun? And some of them will say, well, gee, I don't have any fun anymore like I used to. Before I even get them on the table and do some simple evaluations, already that's the left brain talking to me. The left brain is sort of on lockdown, the analytical brain, the trying to figure out, trying to deal with all the stresses in life. Whereas the more creative, the right side of the brain, the more what we'll call the fun side of the brain, is sort of turned down. It's if the volume has been turned down because of stress and because of cranial distortion. So again, when you look at a patient, you see the one eye is smaller, the one eye is lower, ears are rotated, one ear is lower, one maxillary arch is lower than the other. Cranial distortion, osseous, bony cranial distortion. That then impacts negatively on how the brain will function. After the CRT, you will see changes. And if you go back after a few CRTs, a few visits, and ask the patient, by the way, how's things? What do you like to do for fun? They may, and I heard patients many times say to me things like, gee, I haven't played chess in all those years. I used to love it. And now I'm playing chess again. Or now I'm playing badminton again. Or now I'm riding my bicycle again. Or reading books again, or whatever it is that they consider to be fun. It doesn't have to be something physical. It could be something intellectual. It could be doing crossword puzzles. Whatever it is that they like to do. The cranial release technique is designed to optimize brain function so that people can be what they were designed to be. For more information, whether you're a patient or a practitioner, and wanting to learn more about the cranial release technique, or if you're already a cranial release technique practitioner, try asking those patients about the fun concept. What do you like to do for fun? Cranialrelease.com. You can click on the online training button, learn some more about how do you learn the cranial release technique in the privacy of your home or office. Cranialrelease.com. I'll see you next time. This is Dr. Doreste. Adios, my friends.